Emergencies happen when you least expect them. Now, it might be a family member, a co-worker, or even a stranger on the street. And in that moment, what you do next really matters. Today, we're actually going to walk through common emergencies and exactly what to do if you're ever faced with them. Now, ask yourself along the way, would you know what to do?
Everyday accidents can happen at any moment, often when you're least prepared. And for parents with young children, they can be an almost daily reality. From cuts and burns, to broken bones, and even choking, these types of emergencies can occur without warning. Sometimes they turn out to be small incidents that are simple to manage, but other times they can be far more serious and even life-threatening. That's why it's important to remember that you don't have to handle everything on your own. If at any point you feel the situation is beyond your ability to manage, call emergency services straight away. They can guide you step by step over the phone, offering clear instructions and treatment advice to help you until professional medical support arrives. Staying calm, listening carefully, and following their guidance can make all the difference in those critical moments.
Number 1, choking.
Choking can be a confronting situation to face. It's sudden, it's frightening, and it often causes panic for everyone involved. In that moment, staying calm is the most important thing you can do. A clear head and steady approach will help you act quickly and give the person the best chance of recovery.
Someone who can't breathe. What do you do? If someone's choking and they can't speak, cough, or breathe, time's critical. First, make sure you call in 000 or get someone else to call. Ask them to try coughing forcefully. Now, if that doesn't work, stand behind them and give them up to 5 sharp back blows between the shoulder blades with the heel of your hand. If the airway is still blocked, give up to 5 additional chest thrusts. Place your hands in the center of the chest and push sharply. Similar to CPR, but slower and more forceful. Keep alternating back blows and chest thrusts until the airway clears or help arrives. If they become unresponsive, start CPR immediately. Number 2, asthma attack.
An asthma attack can be distressing to witness, especially when someone is struggling to catch their breath. It's natural to feel anxious, but panic won't help. Remaining calm and composed allows you to think clearly, stay focused, and provide the right support in those critical moments.
A wheeze can turn into 000 call fast. Asthma can escalate quickly, especially if the person doesn't have their inhaler nearby. Sit them upright, never lie them down. Use a reliever inhaler with a spacer if available. Shake the inhaler, place it into the spacer, give 1 puff, then make them take 4 breaths throughout the spacer. Repeat for a total of 4 puffs. Wait 4 minutes. If there's no improvement, repeat the process. Now, if they're still struggling to breathe, getting worse, or you're unsure, call 000 immediately. Number 3, fainting.
Fainting can happen suddenly and without warning, which can leave those around feeling shocked or unsure of what to do. It's easy to let panic set in, but staying calm is what makes the difference. A composed approach helps you assess the situation clearly, respond with confidence, and ensure the person gets the care they need without adding unnecessary stress. Keeping a level head in that moment is the key to guiding everyone safely through it.
They've collapsed, but they're still breathing. If someone faints, they've had a temporary drop in blood flow to the brain. Lay them on their back and loosen any tight clothing. Raise their legs slightly to improve blood flow. They should regain consciousness within a minute. If they don't, call 000. It could actually be something more serious. Once they're awake, help them sit slowly and rest until they feel steady. Number 4, anaphylaxis.
Anaphylaxis is a severe and fast-moving emergency that can be confronting to witness. The sudden change in someone's condition can easily cause panic, but it's vital to stay calm. Keeping your composure allows you to think clearly, act quickly, and provide the right support with confidence. In these critical moments, a steady presence can make all the difference.
When allergic reaction turns deadly, anaphylaxis is a severe allergic reaction that can be life-threatening. Signs include swelling the tongue or face, difficulty breathing, hives, dizziness, or collapse. Act fast. Call 000 immediately. Lay the person flat unless breathing is extremely difficult. In that case, sit them upright. Use an adrenaline auto-injector, an EpiPen if available. Inject into the outer mid-thigh and hold for at least 3 seconds. If there's no improvement after 5 minutes, give another dose if you have one. Stay with them and be ready to start CPR if required. Number 5, burns.
Burns can be distressing to deal with for both the patient and the first aider, especially when they cause visible pain or damage to the skin. In those moments, it's common for people to feel unsettled or rushed, but reacting in a hurried way can make things worse. Staying calm and keeping your focus allows you to respond carefully, take the right steps in order, and provide the support that's truly needed. A steady and thoughtful approach helps ensure the best outcome.
One wrong move can actually make a burn worse. For burns, the priority is cooling the injury quickly, but not with ice. Place the burn under cool running water for at least 20 minutes. Remove tight clothing or jewelry near the area before swelling starts. Never use butter, oils, creams, or ice. They can actually trap heat or damage tissue. Cover the burn with a sterile non-stick dressing or clean cloth. Seek medical help for burns that are deep, blistered, larger than a 20-cent coin, or on the face, hands, feet, or groin. Number 6, cuts.
Cuts are one of the most common injuries you'll come across, and they can range from something very minor to something much more serious. That difference in severity will shape how you respond, which is why keeping calm is so important. By staying steady and paying attention to what's in front of you, you'll be able to judge the situation properly and provide the level of care that's needed.
Apply firm, direct pressure with a clean cloth or dressing. Now, if blood does soak through, don't remove the original pad. Just add more on top. Once bleeding stops, gently clean the wound and cover it. Seek medical help if the cut is deep, won't stop bleeding, or was caused by something dirty or rusty. Number 7, broken bones.
Breaking a bone is often a painful and frightening experience for the person going through it, and emotions can quickly rise in the moment. Staying calm as the responder not only helps you think clearly, it also reassures the injured person. When they see that you're steady and in control, it gives them confidence and comfort, which can make a big difference while they wait for proper medical care.
It's not just about the break, it's about preventing more damage. If you suspect a broken bone, call 000 for serious injuries, or if the bone is protruding, stop movement. Keep the limb in the position you found it. Use a splint or padding to support and immobilize, if you can. Apply ice packs wrapped in cloth to reduce swelling. Treat for shock. Keep the person warm and still until help arrives. Never try to push a bone back into place. Number 8, head injury. A bump on the head can be more serious than it looks. If someone has a head injury, watch for danger signs. Loss of consciousness, vomiting, confusion, drowsiness, or unequal pupils. If any of these are present, call 000 immediately. Keep the person still and laying down. Now, if there is bleeding, apply gentle pressure with a clean cloth, but avoid pressing directly on a suspected skull fracture. Monitor breathing closely. Be ready to start CPR if necessary. Now, in an emergency, doing the right thing can be the difference between life and death. But it's hard to get it right if you've never been shown how. Our First Aid Pro will teach you the skills and give you the hands-on practice to respond with confidence when it counts. Book a course today and learn how to save a life.